There are so many reasons why a medication may not be working well for you, and sometimes it could be the dose, sometimes it could be the specific medication. But really, we're oftentimes thinking about what is happening to that medication after it's been absorbed, after it's been distributed to certain parts of the body, or sometimes before that. And that step is called metabolism. So, I've already talked about in two prior videos absorption and distribution, and so metabolism is kind of that third step. Sometimes it can be the second step, sometimes it's the third step, but it just depends on the medication. So in this video, we are going to talk about, and you are going to understand by the end, what metabolism actually does, where it's happening in the body, why some people access and break down medications faster or slower than other people, and how that can affect your safety, your side effects, and your overall results from that medication. If you're new here, my name is Dr. Takova Wallace-Gay. I am a clinical pharmacist. I'm also the community's pharmacist. And here on my channel, I really want to help make medications make sense for you. So many people are taking medications without fully understanding what they are doing and what their purpose is and why they're taking it. And so here on this channel, I try to bridge the gap between what the provider is recommending or prescribing and what the patient actually knows. So in this video, we're going to jump right into metabolism because I am going back to the basics in the month of October for National Pharmacist Awareness Month. And I just want to talk about what is actually happening once the pill gets into the body. So again, if you haven't watched the absorption and distribution videos, go back and watch those first and then come back to this metabolism video. So, one thing to note is that most of the chemistry that's happening with the medication is happening in the liver. So, a lot of the metabolism of a drug happens in the liver, and that's metabolism is just the breakdown of the medication. And so, we can break down that medication from an active form when we take it to an inactive form, which allows it to be taken out of the body a little bit easier. We can also take an inactive medication when we take it and convert it into its active form in the body. And sometimes we take an active drug and also the metabolite or the thing that is broken down into is also active. So a couple of different things can happen there. Now, although most of the metabolism happens in the liver, some of it happens in the bloodstream, lungs, other areas of the body, but the overwhelmingly majority of the metabolism of drugs happens in the liver. So again, the liver's job is just to change the makeup of these medications. All right, so once the drug kind of makes its way to the liver, has to decide, what's the goal for this medication, and that really depends on chemically how that med is structured. So it may be that you are taking proteins such as enzymes and breaking down that medication. It also may be that you're adding something to that medication to make it a little more soluble or able to be broken down and removed from the body through the kidneys or through the feces. So the kidneys would be the urine or through your feces. And this metabolism happens in really two phases. So the first phase, as I mentioned, we have these proteins called enzymes that break down the medication and change it. Now, there are tons of these proteins in our body, and we call them CYP or CYP450 enzymes. There are some that are more common than others that we, and when I say we, I mean the scientists that make these drugs, that they design them to be broken down by these certain enzymes, or sometimes these enzymes are just a little more active in the body. But we do have a lot of these enzymes that are responsible for processing and breaking down drugs. So, just to give you an example, some of our cholesterol medications, like the statins, are broken down by an enzyme called CYP3A4. And you don't have to remember that. I'm just giving you an example of what one of the enzymes names is called. That particular enzyme is also blocked or halted by grapefruit juice. So if somebody is on a statin like atorvastatin or simvastatin for their cholesterol in their heart, and they take their medication like they're supposed to, but then they're also drinking grapefruit juice with it. Now this enzyme that's supposed to be breaking down this medication in order to get it out of your body when your body's done using it is being blocked by the grapefruit juice, because the grapefruit juice also acts on that enzyme just in a different way by blocking it. And so then you get a buildup of this statin drug in your system because you don't have enough of that enzyme around or available to actually break down the drug. And so that's when sometimes side effects can happen, or people can have over therapeutic effects, like too much of a good thing can end up being a bad thing. Sometimes the opposite can happen too. There can be foods or other drugs that speed up that enzyme, so then you would break down another drug a lot faster. So sometimes you can stop the breakdown of drugs, you can speed up the breakdown of drugs, you can slow down the breakdown of drugs. So that's phase one, is just breaking down the drug. Phase two, which doesn't always happen second, but that's just how they're named. Phase two is making the drugs more water friendly. And so this means that we would add some type of chemical group, or the liver goes in and adds some type of chemical group to that drug in order to make it pass through the body, pass through the urine a lot easier. So a really common example of this is acetaminophen. The brand name, one of the brand names is Tylenol. So at normal doses, your body will safely add these chemicals to it, which we can call them tags. It will safely tag that drug and make it available so that it can be sent out of the body pretty quickly. However, when you take way too much acetaminophen, so over the recommended dose, all of a sudden we don't have enough tags to tag all of that acetaminophen in your body. And so now it's being broken down in step one, or phase one, into its metabolite, which happens to be toxic. But normally we would tag that toxic metabolite and get acetaminophen out of our body. But if we have way too much of it there, then now we've got not enough tags available for that acetaminophen, and we get a toxic compound building up, which can cause damage to the liver and some other side effects as well. So that's just an example of how we do tag medications, or our system tags medications so that we can get them out of the body a little bit easier. But that system can become overwhelmed if you have too much of a drug in your system. My eyes are also hurting today, so if I'm squinting, that is why. Just stay with me, stay along for the ride. Real life over here. All right. Then the next thing I want to talk about is that some people metabolize drugs really quickly. Some people do so a little bit slower. And that partly has to do with genetics. So we have individuals that we call fast metabolizers and slow metabolizers. The only real true way to know if somebody is a fast metabolizer or a slow metabolizer is to do genetic testing. And there are some specific enzymes that this matters for more. So as I mentioned, there are a ton of those CYP 450 enzymes. And again, there are a few of them that we know it matters a lot for because we have a lot of drugs that are broken down by those. But this could be a reason why one person might say, when I take this drug, it makes me so drowsy, I can barely function. And another person is like, well, I take that exact same dose of that drug and I barely feel anything. It could be that the first person is a really slow metabolizer and that drug is hanging around in their system a lot longer. And the second person is a really quick metabolizer and they're breaking it down so fast that it doesn't have a chance to really have therapeutic effects, so they may need a higher dose of that drug. Neither one of those things is wrong. It's just depending on how your body processes the medication differently from someone else. Some other things that can adjust or change how we metabolize drugs are age, just our overall liver function and metabolism changes over time, your health of your liver. So if you're someone who has cirrhosis or a liver disease, that can affect it. Nutrition, so protein levels, hydration, timing of the meals can sometimes affect the enzyme activity. And then just other medications. So I've already kind of mentioned this, but even supplements can sometimes stop or speed up those protein enzymes and affect other medications that you're taking. I want to leave you with this. You hopefully know some of the basics behind metabolism now. Go back to your medications, look at your med map. And I've got a starter guide for that because I really think it's important to build a med map, and just kind of see for each medication, what are some things that maybe you should avoid, thinking about how quickly these medications are metabolized and does that matter for you. And you might want to start by doing this with a medication that you feel like maybe it used to work and it doesn't work anymore, or really seeing if any of your medications interact with each other. And then sit down and develop some questions for your provider, like, does this medication depend on my liver, or is it one that is maybe metabolized somewhere else in the body? Should I take this with or without food? Because the food is going to sometimes affect how well a medication is metabolized. And then thinking about, are there any foods or supplements that could change how this medication works? So just develop some questions that you can ask on your next visit. And then be prepared to guide your team. So always share your full list of your medications, whether that's a prescription medication, a vitamin, a supplement, herbal, whatever words you want to use here, over-the-counter medication. Share all of that so that your healthcare practitioner can see the complete and full picture. If you want a way to do this, I have a starter guide in the description box below. It's called my Med Map Starter Guide, and that way it will walk you through just the basic points that you need to know about each medication so you can put it all in one place. All right, now that you know, your metabolism, the things that's happening behind the scenes in your body, thinking about food, age, supplements, genetics, things like that that can affect it, thinking about if you're someone who is a fast metabolizer versus a slow metabolizer and what that dose change might look like for you. Think about how you can integrate this into your care, and hopefully this has been helpful for you. If so, hit the like button, subscribe, and I'm going to go try to rest my eyes. Thank you for watching.